How to stop accommodating OCD as a family member. Imagine a family trying to help their loved one with obsessive-compulsive disorder by doing everything they can to reduce their anxiety. It might seem caring, but often, these actions can unintentionally make the OCD worse. Family accommodation happens when family members participate in or support rituals, help avoid feared situations, or change routines to make the person with OCD feel safer. While these actions are usually well-meaning, they actually reinforce OCD symptoms by preventing the person from facing their fears and learning to tolerate anxiety. Over time, this can make the disorder more severe and harder to treat. To stop accommodating OCD, the first step is understanding how these behaviors impact recovery. When family members help with compulsions or avoidances, it provides temporary relief but keeps the cycle going. It's like giving a quick fix that stops the person from practicing facing their fears. Recognizing this is key to making changes. Next, setting firm and consistent boundaries is crucial. Decide what you will no longer do to help avoid rituals or fears. This can be difficult and might lead to strong reactions from the person with OCD, like anger or increased distress. These reactions are normal and part of the process called an extinction burst, where symptoms temporarily worsen before improving. Using structured approaches like behavioral contracting can help. This involves agreeing on specific limits with the person with OCD and sticking to them. Family-based cognitive behavioral therapy techniques, especially exposure and response prevention, are very effective. Support the person in facing their fears instead of helping them avoid or perform rituals. For example, if they are afraid of germs and wash excessively, encourage them to resist the urge gradually, helping them build tolerance to anxiety over time. This process is called exposure and response prevention, and it is considered the gold standard treatment for OCD. Education is also vital. Learning about OCD through psychoeducational groups or therapy can help family members understand the disorder better. Participating in family therapy or support groups can reduce feelings of isolation and teach practical coping strategies. Managing your own emotional responses is equally important. Feelings of guilt, empathy, or frustration can make it harder to set boundaries. Recognizing these feelings and finding healthy ways to cope helps maintain consistency and prevents reinforcing OCD behaviors. Finally, working closely with mental health professionals who specialize in OCD is essential. They can guide you on how to reduce accommodations safely and effectively. When families support exposure therapy and resist enabling compulsions, the person with OCD has a better chance of recovery. Remember, changing family habits takes time and patience, but it is a powerful step toward helping your loved one live a healthier, more balanced life. Reducing accommodation is not about abandoning support but about providing the right kind of support that promotes independence and healing. Always consult with qualified healthcare providers for personalized advice, as each situation is unique and requires tailored strategies.